The Tobacco Control Program aims to reduce tobacco use and protect people from exposure to tobacco smoke. It supports policies and community actions that creates smoke-free environments and encourage healthy lifestyles. In the Philippines, this program is anchored on Republic Act 9211, known as the Tobacco Regulation Act of 2003, and Republic Act 10351, or the Sin Tax Law, which imposes higher excise taxes on tobacco products to discourage smoking. This program also aligns with the World Health Organization's Framework Convention on Tobacco Control. This is a global treaty promoting evidence based tobacco control strategies. The Tobacco Control Program is both a public health initiative and a moral responsibility. Its goal is not to punish smokers, but to protect health and empower individuals to live tobacco free lives. Why is this program very important? First, tobacco is one of the leading causes of preventable deaths nationwide and also worldwide. According to the World Health Organization, over 8 million people die each year to tobacco related illnesses. And around 100,000 of these deaths occur in our country. Second, smoking contributes to heart disease, cancer, and respiratory illnesses, such as COPDs. These are among the top causes of mortality in our country. Then, this program also protect people from tobacco exposure, which improves the overall population health and helps reduce national health care costs. Preventing smoking related diseases save lives, resources, and families from emotional and financial strain. These are the primary goals of the Tobacco Control Program. One is to prevent the initiation of smoking, especially among the youth. This means stopping young people before they even start. Though it might be hard, but we can do this through education, awareness campaigns, and strict enforcement of laws prohibiting tobacco sales to minors. Another one is to promote cessation and support individuals who want to quit. The program provides counseling, quit lines, and referral systems that guide smokers through quitting their smoking journey. Then there is the enforcement of smoke free environments and reducing tobacco related diseases. This includes implementing smoke free policies in public places, schools, hospitals, and workplaces. The Tobacco Control Program has these major components. One is the policy and regulation. This involves bans in tobacco advertising, promotion, and sponsorship. By limiting exposure to cigarette marketing, we reduce the likelihood of young people taking up smoking. Another component is health promotion. This focuses on public awareness campaigns that communicate the dangers of smoking and the benefits of quitting. For example, we have graphic health warnings on cigarette packs and media campaigns, which could also be powerful deterrents. And then we have cessation services. These include counseling and referral programs to support those who want to quit smoking. Nurses, as frontliners, play a big role in counseling and connecting patients to available resources. One of the legal foundation of the Tobacco Control Program is the Republic Act 9211 or the Tobacco Regulation Act of 2003. This act prohibits smoking in public places. This also regulates the sale, distribution, and advertisement of tobacco products and enforces the on tobacco sales to minors. Then we have the Syntax Law or RA 10351. This law imposes higher taxes on tobacco and alcohol products. The additional revenue from from this law funds health programs, including those in universal health care and in smoking cessation. And then we have the WHO Framework Convention on Tobacco Control. This is a global treaty signed by more than 180 countries, including the Philippines. This treaty encourages countries to adopt evidence-based tobacco control policies, such as smoke-free laws, tax measures, and public education. Smoking increases the risk of lung cancer, heart disease, and COPD. This is one of the top health consequences of tobacco use. These conditions develop slowly, often after years of exposure. For pregnant women, smoking causes pregnancy complications and low birth weight in infants. This can lead to developmental problems and higher infant mortality. And it is not only smokers who are affected or who suffer. Secondhand smoke harms non smokers as well, especially children and the elderly. Inhaling smoke from others increases the risk of asthma, pneumonia, heart diseases, and even cancer. In short, tobacco is a public health epidemic, and every stick of cigarette smoked adds to the problem. Tobacco affects not only people but also the planet. Cigarette butts are non biodegradable and are among the most common forms of litter worldwide. They contain toxic chemicals that contaminate soil and waterways. Tobacco cultivation depletes soil nutrients and often involves heavy pesticide use, harming farmers and our ecosystems. And then, of course, cigarette smoke pollutes the air and reduces indoor air quality, especially in enclosed spaces like jeepneys, or small homes. Thus, tobacco control is also an environmental health issue. By reducing tobacco use, we protect both the people and our nature. The establishment of smoke free environments is one of the strongest strategies in the program. Smoking is prohibited in schools, hospitals, workplaces, and public transport. These are areas where exposure to smoke could harm vulnerable populations. The LGUs play a vital role in enacting smoke free ordinances, ensuring community compliance. Community driven campaigns such as Bawal Manigarilyo zones help normalize tobacco free living. When entire communities take pride in being smoke free, it creates a ripple effect that promotes wellness and accountability. As nurses, we are in a unique position to influence behavior and policy at the community level. We provide smoking cessation counseling and referrals to individuals who want to quit. We conduct health education about the dangers of tobacco use during clinics, home visits, and barangay assemblies. And we serve as role models for tobacco free lifestyles because credibility begins with our own example. As advocates, we support the enforcement of smoke free policies and ordinances, ensuring that local laws are properly implemented. We collaborate with LGUs and NGOs to organize tobacco prevention activities such as awareness campaigns and quit smoking drives. And we participate in school and workplace campaigns that promote healthier environments where people can work, study, and live free from tobacco exposure. One of the major challenge in implementation is the influence of tobacco marketing. Despite restrictions, indirect advertising through movies, social media, and sponsorships continue to glamorize smoking. And there is still social acceptance of smoking, particularly among adults who view it as a form of stress relief. And we have the weak enforcement of smoke free laws in some areas and limited access to cessation programs, which make quitting difficult for those who want to stop. One of the most powerful strategies we can propose and implement is to strengthen information campaigns, targeting the youth and vulnerable groups, using creative platforms like social media to counter pro smoking messages. We can also expand access to cessation clinics and telephone quit lines so smokers receive continuous support. Then we can promote intersectoral collaboration between health agencies, schools, and private organizations to enforce policies and conduct health education. To summarize, the Tobacco Control Program is a national effort to protect public health by reducing tobacco use and secondhand smoke exposure. It relies on strong policies, consistent education, and accessible cessation support to achieve lasting change. And at the heart of all of these efforts are we nurses, as educators, counselors, and advocates, helping Filipinos make informed choices toward a tobacco free, healthier future. Let us remember every person we help to quit smoking is one life reclaimed.